Hello, everybody. I am Dr. Kelly OMZ, board certified OB-GYN and healthcare executive here to help you live your healthiest and wealthiest life. We call this Viva Life, Live Life, and it's spiritually, physically, mentally, financially, and emotionally your highest and best. I'm so excited to hear from Dr. Robyn White. She is a doctorate of nurse practitionership. We are so excited to have her here. She's going to tell you about her story with breast cancer, not just surviving, but thriving. She turned lemons into lemonade. And Robyn, tell us a little bit about yourself and how you want to help us make a difference, not only for ourselves, but for 1 million people around the world.
Awesome. Well, thank you, Viva Lifers and Dr. Kelly O. It's a pleasure to be here. First, I just want to introduce myself. My name is Dr. Robyn White. I'm a board certified family nurse practitioner who serves a vast amount of the community, specifically have my heart for women. And it's just fitting that I am here today. I was recently diagnosed with breast cancer on my annual screening, which took place back in November, where they found 2 suspicious masses, which then led me to make the decision to get a mastectomy and now a full reconstruction. But through my journey with breast cancer, I just had an awareness of how I wanted to make sure that people took the time to take care of themselves. We're busy moms, we're busy wives, we're busy everything, just like myself. And I know it seems impossible, but if we could just take the time for early detection, it really can save your life. So I launched last week a campaign. The campaign is You Are Not Alone. Join the 1 Million Mammogram Movement, hosted by me, and I aim to hopefully resonate with women and men who have hesitated to get mammograms due to fears, frustrations, or lack of awareness. And hopefully through my story and my storytelling, and my own personal testimony, this campaign can seek to help demystify mammograms and showcase the widespread support available and inspire individuals to take action for their health. So my 3 goals are to increase awareness about the importance of mammograms, encourage at least 1 million women to take the pledge to get mammograms. So if you sign up on drrobynwhite.com, there's a pledge form, and all you have to do is make a pledge to just go get a mammogram. If you know someone that's struggling, you can also encourage them to get a mammogram. And with that, we're going to build a supportive community around the participants, providing reassurance and helping others realize that you are not alone. 1 million mammograms. We're on a mission.
We're absolutely on that mission, and we're on a co-mission with you because, as Viva Lifers, we are here to positively affect and impact and change 1 million women and their families' lives. So, Dr. Robyn, you and I together, we're about to make it rock.
Let's do it.
Let's do it. That being said, so Viva Lifers, as you know, I have shared with you that in my late 20s, I did have a mass, and I remember my best friend telling me, I was like, oh, I have a mass in the right side of my breast. I think it's about 1 centimeter. And I'm like, I'm doing my breast exams. I'm like, yeah, no, it'll be all right. My best friend, who was a general surgeon and a thyroid surgeon, looked at me and said, if you don't get yourself into that
right now
and go get your ultrasound done right now. And she was like, and don't go past the biopsy, then we're going to have a conversation with you. So Dr. Robyn, this is not about me, but I wanted to share that with women yes, you definitely need to get screened early. And if you feel something, make sure you say something and get it checked out. So Dr. Robyn,
even if you don't feel something, Dr. Kelly, I think that's another thing. I didn't feel anything. I was living my best life, okay? Traveling, doing everything. And I've been getting mammograms since 40. I'm 46 years old. So it was just kind of a checkbox. Let me go get my mammogram. Never in a million years would I have thought that it was going to come back suspicious. And I don't know about you. I'm glad you had your friend as a general surgeon. But for me, 1 out of 8 women will have breast cancer. So out of my tribe of friends, I'm the one. So I didn't have anybody that was going to say, well, what do you do? How do you do? So I really needed support. I needed support from other people that have, like yourself, been through it, because it comes across different when you have somebody that can authentically walk through that journey with you. And that's why this campaign is so special. It's not just to get numbers. It's really just to raise awareness, to save lives. I tell people, screened by 15, screened in 15. It takes 15 minutes to get a mammogram. I mean, think about you scroll on Facebook for 15 minutes. You could go get yourself a mammogram, right? So I really just want to bring awareness, help support women, because the time period, I don't know about you, but the time from that mammogram to the suspicion, to the biopsy, to getting the biopsy result, it feels like eternity. And so you need support through those stages so you know that you're not alone. So again, join me on 1 million mammograms. I have this little gang sign my daughter made up, 1 million mammograms, to help get women to get out there and just don't feel afraid. You're not alone.
All right. So just tell us a little bit about, your journey from that point. I mean, you're a provider, right? So we just talked about you're a registered nurse first, then you went back and got your doctorate. And then you were taking care of patients. And like you said, living your best life and taking care of patients. So tell us about that from, a provider perspective as well as a patient perspective.
Well, from a provider's perspective, you kind of know too much. So I feel like when I went and I got the mammogram, and I got the report back and you read it. And of course, I was reading it probably sooner than my doctor actually could show me, because when you're connected like that. And so you're reading the words like suspicious and you're seeing malignancy, those words kind of hit your heart a little bit. But I told myself, I'm not going to worry until I have a real diagnosis. So as a provider, I kind of knew, because I've walked women through this type thing, but it's so different when you're on the other side. So of course, my mind goes from A to Z, from death to leaving my 2 beautiful children behind. But the one thing I can say is that I tried to let the doctors be the doctors and let myself be the patient. And I think that was the biggest thing I needed to do. Don't get on WebMD. Don't talk to people, right? I was taking my advice that I tell my patients, like, just don't worry until there's something that we need to worry about. So that's kind of, it was a trick in my mind, but through it all, we got it. We got through it. We got through it.
Yeah, and you actually mentioned something that's really important, and you said the electronic health records. So many of us have switched to electronic health records where we can actually see our results, right, before others. And I know as providers, we can see them even faster. But, kind of tell us about that from a kind of a patient standpoint, looking through your electronic health record and seeing something like that. I know a lot of women get frustrated because the doctor hasn't called me back yet. And the doctor is seeing 20, 30 patients a day and trying to get results as well. So, kind of walk us through that about the importance of being connected.
Yes, being connected is great. Just like we have social media, being connected can be a great thing, but it also can be a little bit of a barrier to understanding what you're going and what you're reading, especially if you're not educated or you don't have health literacy. For me, because I do have that, it was nice that I could get the report so quickly. So many of you don't know, but I have to go outside of my original network to get care, only because I'm in a remote area. And so they have my chart. I'm not advertising for my chart. That's just what I have. And that's my electronic record, which I had never had before. And my chart's nice because it's an app on your phone. And the minute something comes in there, it's there, it's live. And so for me, I actually got my pathology report before my doctor called me. So I got my pathology report on a Friday. He called me Saturday morning, bless his heart. He just wanted, because he knew that, right? He knew that this my chart situation would have that. So after I got my actual mastectomy, the pathology report came back. But as far as the suspicious mammogram, I got that back. And I made my appointment with my PCM before my PCM even had my results. Yes.
And it's interesting you bring that up, because a lot of times when the radiologist, because we go to a radiologist, which is a different physician than your primary care. You go to the radiology suite, and if they see something, then many places right then and there the radiologist will come in and talk to you about it.
Yes.
And then do recommendations for guidance or further options
Care.
for it.
Yeah. And for me, actually, that was a blessing, because in my current, where I'm currently getting care at, the place I got my mammogram had an ultrasound tech and a radiologist. And so within 1 to 2 weeks from my diagnosis, I was able to get the second mammogram, the ultrasound. And Dr. O, when that radiologist came in to look at that report, it was then that I knew that I had breast cancer. It was the way that she was talking. Of course, I hadn't had the biopsy yet, but because I'm a provider, it was the way she was preferencing it, as
Mhm.
if almost kind of like, I'm so sorry to tell you this, but I'm not really telling you this. It's not official, but you need to prepare yourself. And so she even gave me an example of her own story with breast cancer and how they just found it on a regular early detection screening. In my mind, I'm like, why is she telling me this story? I'm not receiving that. I don't have breast cancer, right? But now looking back, I know that she was really trying to be tender with her words, but also try to prepare me for what was to come. But having all of those individuals in the same area was the reason why I was able to get access to care quickly, and then quickly to the biopsy, right? So in a month's time, I had diagnosis, biopsy with detection, biopsy, and diagnosis within a month, which is remarkable.
And then just kind of backing up. So most women should start getting mammograms at what age?
Well, they just changed the recommendation, so now it's actually recommended at 40 years old that you should get mammogram screening. You can get them biannually, but you can also get them every 2 years, or you can get them one annually every year. So that is the new recommendation. And I will say that the incidence of younger women getting breast cancer is high right now. So I would encourage every woman, because this is kind of not a known fact, that starting at 40, I do recommend that you get your early detection. Because like me, I'm 46. The old recommendation used to be 50, Dr. O. And if I would have waited till 50, this would have been missed. So
Yeah. And then one of the important things there was a difference in recommendation from the American College of
yes,
OB-GYN versus the
task
CDC
force.
versus the
Yeah.
American Radiologist. So people were kind of confused. So they would say, between the ages of 40 and 50, you get your mammograms every 1 to 2 years, depending on,
Yes.
listen to. But I, as an OB-GYN and, women's health practitioner, I was always like, no, head to toe exam
Mhm.
annually as mammogram starting at age 40. And if you have a
Yes.
family primary family history, then we need to start 5 years ahead of that as well.
Yes,
So
yes. I think that's important too, is some people don't know. They don't have beautiful friends like you, Dr. O, that they can just figure out what the recommendations are, when to get it. And so that's a part of this 1 million mammogram campaign too, is to bring education and awareness of when, because again, early detection saves lives. Early detections allows mothers to be mothers, to see their children graduate from college, to see their grandchildren. And so it's really important that we get the right information out. Because even as a provider, I remember when I graduated nurse practitioner school, looking at all the different blocks for the recommendations. And I'm like, which one do I go with? And I'm like you, very conservative. Everybody 40, get your mammogram. So yes, I'm grateful for that.
yeah, and you know what? Allowing mommies to be mommies, aunties, and godmommies, and all of the women. And you mentioned, men too. Men too
Yes,
get
yes,
especially when we're talking about the breast tissue being larger, so kind of having that like that adipose tissue in the breast, fat tissue in the breast. So it does make a difference there as well. So as you were talking about, having the screening, and then they do a diagnostic mammogram or biopsy, usually a biopsy along with an ultrasound, I believe as well. So
yes,
from you tell us a little bit more about that story. And you said one thing that I think is really important. You didn't you wouldn't receive it. It's not that I don't know if it wasn't that you wouldn't accept the diagnosis or you wouldn't receive the diagnosis. So,
yeah,
so talk about that, because I think really especially having a spiritual foundation, we are very careful about what we will allow people to tell.
yes. Yes. And you practice this. I've watched and followed you. Our words are powerful. What we allow in is powerful. What we allow in our space is powerful. That's why we have to set intentions on the day. So for me, with this whole walk, this whole journey, I was very careful with who I even told. And even when that radiologist was kind of hinting to me that I had breast cancer, I didn't accept it. Not that I wasn't going to do something about it. It's just that I needed to make sure there was a confirmation by a actual tissue that said it was breast cancer. And even if you heard my story all along, Dr. O, I always said I have been diagnosed with breast cancer. Breast cancer doesn't have me. I
Mhm.
am not breast cancer. That is a diagnosis. And so with that, everything that has a name has to submit. That's in the word. So what I began to do is post scriptures about healing all around my husband. How I knew he was in a fight is one morning I woke up and there were scriptures about healing all in the bathroom. It was on in the washroom, in the water hole, just so that I could constantly flood myself with positive healing scriptures. And I believe from that point on, I had started to get healed. And so I don't know if I didn't get to tell this part of the story, but when they took out the breast tissue, they only saw 2 masses on
Mm.
mammogram. But I
Mhm.
decided to get a full mastectomy. And when I did that, the pathology report actually showed 2 smaller lesions that were undetectable on the mammogram. So if I
Mm.
would have just chose to do a lumpectomy, and a lumpectomy is basically where they just take the lump, they just take the mass and leave out all your other breast tissue, that those 2 small lesions would have continued to grow. And so because I did that, I was able to ensure that the cancer was eradicated. I didn't have any lymph node involvement, so I didn't need chemo or radiation. Praise God. That was another prayer. Yes.
Yeah. Okay, so my V of lifers know I'm about to jump in on 2 things.
Okay.
Number
Yes.
the positive the healing powers of positive affirmations. As you know, we have a program called Viva Life, where SPF me, where we focus on every month we do the affirmation room, and between those days we do a podcast where we are affirming, we are forgiving and releasing, denying negative things from coming into our life, and being grateful for all of these
Yeah.
things. So, I almost started crying when you mentioned that your husband had put up so many post-its around you to surround you with healing thoughts and positive affirmations, because you are right. Your mind started healing your body immediately
Yes.
with
Yeah.
that.
Mm-hmm.
Really a beautiful statement and story. So thank you so much for sharing that piece. And so, okay, so then it was time to make the decision about, you said you had the surgery, but what made you have the surgery instead of doing maybe a lumpectomy versus a mastectomy? And then, not to be all in your business, but
Oh, please be in it.
you can do a unilateral or one breast,
Mhm.
or you can do a bilateral 2 breast removal, and you can get plastic surgery to help give you a new set.
Plastic surgery if you just want to get them done and just get some nice tatas
Yeah.
for the there's so many options. And thank you for letting me share this. And I'm sorry if I get a little emotional, because I think that this may be the first time that I've actually said the words out loud about the decision, because it's a very personal decision. And it was a hard decision, right? I know as women, we feel like our breasts define us because they've been with us for all of our life. My breasts allow me to breastfeed both of my children. Um, my breasts probably got my husband's attention at one time, so it was a big decision. And just so you know, I used to have big pendulous breasts as a child. Like, first person in the gymnastics uniform, I was the one that had the little bumps. And so I had got a breast reduction 2 years ago just to get
Mm.
some freedom, just to be able to breathe and jog without 5 sports bras. And I really think, looking back on that, that was just God's aligning things, because I had so much dense breast tissue, and women with color have dense breast tissue, and a lot of times masses are missed because of that. And so when I got the breast reduction, the reason why I didn't think that this was breast cancer is because I have a lot of scarring from the reduction. So I was kind of saying, no, it's not cancer, it's scar tissue. That's kind of where my mind was going. But I chose to do, so you asked like what made the decision. So when I first heard I had breast cancer, I wanted them to take everything. I went into the surge. So I'm trying to not jumble the story, but when you get diagnosed, I gave myself one day to be bitter, to be angry, to cry. When I got the diagnosis, I took one day. I called off work. I laid in the bed all day. The
Mm.
next day, I got up and I started making my calls for my oncologist, for my surgeon, that you get a breast navigator who will call you and help you make all those appointments. So I gave myself one day. And then the next day I said, okay, it's time to fight this. And that was the day my husband had posted those scriptures. So when he did that, I said, okay, we in this, And so I made all those appointments. And so the first appointment I had was with my surgeon. And so he was the one that went over all of the options you talked about, the lumpectomy, the mastectomy. You can get bilateral and get breast reconstruction through plastics. So when I went to him, I had a plan. Take it all. Just take it all and I'll get new breasts. That was my plan. But after going through and learning that I didn't have the gene for breast cancer, I had the MRI that didn't show that it was breast cancer in my right breast. And then having an intimate moment with my husband brought me kind of to tears, because I feel like I'm, not to be TMI, but we talking about it, but I'm a breast person. Like, I get aroused by breast stimulation. So I just was like, oh my gosh, I'm not going to have any breasts. Like, it hit me. And so me and my husband talked it out, and I said, hey, listen, we got this one hitter we're going to keep. Okay. And so we decided we decided to keep the one breast and just take the left breast. And I decided to do reconstruction surgery. It's called a DLAP. And basically it's when they take, I hope I'm saying that right. Don't quote me on this if I said that right. I think it's called, anyway, it's when they take tissue from your stomach or your back and they form your breast. So I had a mastectomy on March 11th, and I went right into reconstruction on April 1st. To take the tissue, I got a tummy tuck, sis. So I got the tissue, I got the tissue removed from my belly. And see, it was good for me to keep that extra fat because it made me a new breast. And now, as you can see, you can't really tell the difference between the two breasts. And I'm very happy with my decision. So coming soon to a beach near you in a bikini. I got to get on the workout program though first.
Welcome, welcome, welcome to the Viva Life. We got you. We got you. Thank you so much. And TD also said, thank you so much for being vulnerable and transparent with your decision. And it's all, you know, you're just going to change even more lives with that type of presence and presentation. People really can feel that. I felt it. So this is the second time you're about to make me cry on camera. Okay.
Your makeup's too pretty. Don't do it. But I always say, you know, my story for his glory. Really.
Yeah.
If he didn't save me, then why?
Right.
You know, so I want to be authentic with my message. I want to be transparent. I want you to feel those feels, because now you'll remember, and then you'll help another woman remember. That's the goal.
Absolutely. Absolutely. And, you know, in saying that, I know we have about 7 minutes left. It's gone so fast. This is how fast it's gone. So number one, you got diagnosed 2 months ago. I mean, gone through surgery 2 months ago. So, and then, you know, you actually signed up for this even before.
Yeah, I was in recovery. Like I don't even, I think I was just having my first mastectomy, my first surgery when I signed up for this. I had no idea 1 million mammogram campaign was going to come, but it's something about going through a journey and having to sit still and having to sit with your feelings and your thoughts. And like you said, turn those lemons into lemonade. And I mean, that can be a whole nother episode of how God birthed this movement, because it really was God ordained. When I tell you, it really was God ordained. Even booking you in this conversation a week before the launch of the 1 million mammogram campaign. Only God does things like that. No one else can ordain those steps accordingly. So yes, it was, I got diagnosed in November, surgery, mastectomy March, and then reconstruction in April. And I'm doing good. I mean, I'm really doing good. I feel good. It definitely takes a toll on you. You have to really love your body. Luckily, I loved my body before this, so it's easy, but it's still difficult. You look in the mirror and you're not the same. The scars kind of stay there and remind you, but I just thank God I have life. Viva life.
Life, and life more abundantly. Let me tell you about the that are going to pour down all over you because of being obedient to what your higher power, your God, is telling you. And that, thank you so much. So everybody, please follow Dr. Robyn White at Dr. Robyn White on Instagram. I did post your website and the pledge site in there as well. Please follow me as well at Dr. Kelly OMD or Viva Life Health Hub. Remember, this opportunity comes on Monday, 7:30 p.m. Eastern Time. We have different special guests, and you know, the Lord just happened to bring us a very wonderful, experienced Dr. the Nurse Practitioner. Thank you so much for being here, and don't forget to do what, everybody? Viva Life. All right. Thank you for being a part of the Viva Life experience. I'm Dr. Kelly MD, board certified OB-GYN and healthcare executive. If you like what you heard, then please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Viva Life.